A new study aimed to determine if persistent inflammation and ongoing T-cell activation during convalescence were a contributing factor to pathogenesis of long COVID. Researchers followed 52 individuals with long COVID. They isolated peripheral blood mononuclear cells and stained for multiple T-cell activation markers. The activation states of participants' CD4 and Cd8 T cells were also analyzed for each of the persistent symptoms. Overall, researchers found that participants with persistent symptoms had significantly higher levels of inflammation at multiple time points during convalescence when compared to those who fully recovered from COVID-19. They find that Cd8 T cell activation following SARS-CoV-2 infection in adults experiencing post-acute sequelae of COVID-19, and that the increase in T regulatory cells for a subset of these patients represents the ongoing attempt by the host to reduce inflammation. As a quick side note, regulatory T cells are T cells that respond when there is autoimmune damage occurring. They try to call the immunological attack occurring. People with persistent dyspnea, which is difficulty breathing, forgetfulness, confusion, and chest pain had significantly higher levels of effector T cells, and those with chest pain, joint pain, difficulty concentrating, and forgetfulness had higher levels of regulatory T cells. Additionally, those with dyspnea had significantly higher levels of CD8, CD38, CD8 and granzyme B, and CD8 interleukin 10 levels. A retrospective comparison of acute phase inflammatory markers in adults without long COVID showed that Cd8 Ki67 cells were significantly higher at the time of acute illness up to 14 days post-diagnosis in those who develop persistent dyspnea. Conclusions: persistently elevated inflammatory T-cell markers may contribute to the development and progression of multiple long COVID symptoms. The continued Cd8 T-cell activation following SARS-CoV-2 infection in adults experiencing long COVID likely is representative of persistent infection, and that the increase in T regulatory cells for a subset of these patients represents the ongoing attempt by the host to reduce inflammation. Chronic inflammation is a risk factor for other chronic conditions such as cardiovascular, cerebrovascular, or autoimmune disease, which heightens the significance of follow-up investigation with this cohort. The data from this study support a growing body of evidence associating PASC with persistent inflammation and immune dysregulation as early predictors of disease, and warrant attention towards appropriate therapeutics and interventions for the prevention and treatment of PASC, also known as post-acute sequelae of COVID-19. Here's the name of the study, posted in Frontiers: Persistent Cd8 T Cell Proliferation and Activation in COVID-19 Adult Survivors with Post-Acute Sequelae, a longitudinal observational cohort study of persistent symptoms and T cell markers. I wanted to include this part because even though it wasn't findings of the paper or included in the overview, it was important enough that I wanted to share. It reads: lower frequencies of the degranulation marker CD107A in CD8 T cells have been observed in PASC patients 4 months after initial infection, suggestive of cytotoxic T cell death during degranulation, meaning CD8 T cell death. So, if they are chronically stimulated and chronically dying, and they are a finite resource, well, you do the math.